Hey Brandy, it's Heather. I thought I'd take a minute to respond to your discussion board because I really enjoyed reading it. I love how you kind of talk about, the three medications that are out there for medication assisted treatment, specifically kind of for those opioid use disorders. What's interesting is a lot of the articles I found kind of went into the history of, okay, let's talk about all three of those medications, what they treat, and of course, as we know, methadone is the longest one that's been out, right? So that one's probably the most used. And then you got the, buprenorphine that has been out as well. The article that I'll post the reference at the bottom of this, but the article that I was reading, started talking about naltrexone. That one is, of course, a little bit different, but it's, I guess I would say like the newest one. So like they're still doing research on it. So like the quote I found on the article that I found, it says it has less of a historical basis for effectiveness, but a newly evolving literature warrants attention. So more research is kind of being done on that. One of the other articles I found talked about like especially doing research not only on these medications, but combine the medication and therapy as well. Because, one thing you said was it's kind of unclear, like the time frame, right? The time frame that we're going to use medication assisted treatment. Everything that I found, and specifically in this article too, it talks about this is long term. This is long term treatment. There's no like, hey, 90 days, a year, 2 years, like this is going to be long term treatment for somebody who's struggled with addictions. But I'm glad that they have, that support as well. When thinking about like psychotherapy, kind of combined with medication assisted treatment, you are exactly right that both need to be used, because you started talking about some of the gaps in the research, include the long-term data as well as sample sizes of participants, but also like you said, like medication assisted treatment is underused, compared to psychotherapy or drug counseling. What's interesting is in the article that I was reading, it was saying if you just use psychosocial interventions, so just psychosocial, just probably therapy support, for example, intensive residential treatment where you stay, the return to opiate use approached to 80% within 2 years. So as much as CBT has been researched, as much as, psychotherapy and psychosocial support is really good, that's only one part of the treatment. The other part is, the medication assisted treatment. And so the more that we do some research on like combining, right, a combinatorial approach, the better, treatment for our clients dealing with this. As we know, we're in an opioid crisis right now, so the more research we do, the more treatments we have, the better, because I do think those numbers are ever increasing. So I really enjoyed reading what you had to say. I hope that you have a good weekend. Thanks.